Lymphedema of the limbs results from a dysfunction of the lymphatic system, which leads to lymph stasis, causing an increase in the volume of the affected limb. Involvement of the limbs, particularly the lower limbs, is the most common form. This disease is chronic and can seriously affect the quality of life of patients due to pain, functional discomfort, and aesthetic impact. The lymphatic system is an essential component of the circulatory system, playing an important role in maintaining the body's fluid and immune balance. This complex network connects to the venous system through two main channels: the right lymphatic duct, which drains about 25% of the lymph, and the thoracic duct, which drains the remaining 75%. In the normal state, the lymphatic system is responsible for draining excess fluid, proteins, and certain cells from the body. This process prevents the accumulation of interstitial fluids and the formation of edema. Moreover, the lymphatic system actively participates in key biological processes in immune activation by allowing the transport and distribution of immune cells that ensure the body's defense against infections, in healing by facilitating the repair of damaged tissues through the transport of growth factors and reparative cells, for detoxification of tissues by eliminating metabolic waste, toxins, and other harmful substances that accumulate in body tissues. In the pathological state, when there is an alteration of the lymphatic system, as in the case of lymphedema, the consequences can be severe. The stagnation of proteins in the tissues leads to water retention, thus forming a protein-rich edema. In response to this accumulation, macrophages, cells of the immune system, are activated. They stimulate fibroblasts, which are cells responsible for the production of collagen and elastin, two fundamental components of the extracellular matrix. This process leads to the formation of fibrosis, a hardening and excessive scarring of the affected tissues. Finally, this fibrosis can cause a local immune imbalance, making the affected areas more vulnerable to infection. Lymphedema can be classified as primary or secondary, depending on whether it is due to congenital abnormalities or damage to an already functional lymphatic system. Primary lymphedema results from a congenital dysfunction of the lymphatic system. It can appear in different forms: familial congenital, Milroy's disease, a hereditary form of primary lymphedema. It generally manifests at birth or during childhood through an abnormal development of the lymphatic vessel. Non-familial congenital, Meig's disease, is a form of lymphedema that usually appears after childhood. Lymphedema of young women. This primary lymphedema is triggered after a precipitating factor such as a wound or an insect bite. And secondary lymphedema occurs when a previously healthy lymphatic system becomes damaged, generally due to external factors. This form is more common and is characterized by an edema that often begins proximally and may spread, sometimes involving the external genital organs. The edema usually begins in the thigh, suprapubic region, or arm. The edema may become fibrotic over time. It can be present on both sides of the body. Negative Stemmer's sign refers to the absence of skin hardening at the base of the toes or fingers, which helps differentiate lymphedema from other types of edema. The causes of secondary lymphedema include medical interventions such as radiotherapy or surgery, notably lymph node dissection after mastectomy. Inflammatory causes like erysipelas, which is a bacterial skin infection that can damage the lymphatic vessels and lead to lymphedema. Filariasis, the most common cause worldwide. This parasitic infection can block the lymphatic vessels and cause edema. Traumatic events such as wounds or burns can damage the lymphatic system. Lymphedema can lead to complications that affect the patient's quality of life and may sometimes be severe. The accumulation of lymph and stagnation of fluids create a favorable environment for infections. Erysipelas, often caused by streptococci, which can lead to inflammation, pain, and swelling. Lymphangitis, which is the inflammation of the lymphatic vessels, often accompanied by pain, redness, and warmth. Cellulitis, a bacterial infection of the skin and underlying tissues. Fungal superinfection. Due to lymph stagnation and humidity, fungal infections such as mycosis are common and may affect the skin. Malignant transformation, Stewart-Travis lymphangiosarcoma, a rare complication of chronic lymphedema occurring in 90% of cases in the context of a history of breast cancer. This rare and aggressive form of cancer develops from the lymphatic vessels and is associated with untreated chronic lymphedema. Vascular, rheumatologic, and neurological complications like deep vein thrombosis. Due to blood stasis associated with lymphedema, there is an increased risk of blood clot formation in the deep veins. Rheumatologic complications like joint pain, stiffness, and inflammation, thereby affecting patient mobility. The pressure exerted by the edema on the nerves can cause pain, numbness, or tingling, affecting sensations and nerve functions in the affected area.